Hello, my name is Carmen Valle and I'm the Senior Mental Health and Psychosocial Support Advisor at the MHPSS Colloborative, which is hosted by Save the Children. I want to take this opportunity to highlight some important considerations regarding mental health and psychosocial support in this COVID-19 pandemic. One of the first things that I want to highlight is that it seems very obvious that everybody is addressing mental health and psychosocial support as one of the key consequences of this crisis. We are hearing and reading everywhere that people are stressed, that are finding it very difficult to cope with the circumstances, that the levels of distress of the first responders are very high. This is not news. This is something that happens with all crises, but I think it's really positive that we are naming it so clearly this time, that we are saying mental health is at the center of this pandemic. With that comes the responsibility to respond to it and to pay attention to it and start putting in place the responses that are necessary. There are many lessons learned from previous crises on how can we offer support, engage in different levels of the community. We don't have to rely on specialists. We can do a lot by training the community and other responders on mental health and psychosocial support and psychological first aid. But also we need to pay attention to the gaps that are being highlighted. Crises have this capacity to point at what was missing to start with. And again, this is an opportunity that we cannot let go. There's this concept of building back better that I find fantastic. If the crisis is going to point out so clearly at what was missing, what was the failure of the system, can we use this opportunity to start right now building the services so by the time of the crisis they're even better than the ones that we had. And I want to make the connection between this reality and all of this impact that COVID-19 is having on all of us, to make an effort to think a little bit beyond our own situation and imagine how this is being lived by communities who are already affected by other crises, by communities that are affected by conflict or natural disasters or poverty, or by refugees and asylum seekers that are now in contexts where they can't even have the luxury of isolating themselves in their own homes. If the response in general is much more complicated in these communities, mental health and psychosocial support is not an exception. It's going to be very difficult, as it is for us, but with the other pressure of those really terrible circumstances, for those communities to cope and for those communities to be able of addressing all of those mental health needs. The children and families in these communities are going to need a lot of support in these circumstances if we want them to be able of coping with the illness and to stay safe. The reality, though, is that mental health and psychosocial support frequently receive very little attention. As I said at the beginning, we are now being very aware about how a crisis affects us very deeply. But that has not been the reality all of these years. Unfortunately, in humanitarian context, mental health and psychosocial support is still addressed in a very limited level, and resources and funding are very scarce. So I want to encourage the entire international community to take this opportunity to realize how important it is to put mental health care at the center of the response and use the necessary funding and the necessary resources to support these communities. We know what needs to be done. We've built many lessons learned from past crises, and we have a vast understanding of what can be done, how can it be done, and what kind of training can be facilitated, who can be part of this response. All that these agencies that have this knowledge and this capacity need is the funding and the resources to do so. So I want to encourage all of us to make an extra effort and make sure that everybody has the opportunity to recover from this pandemic, not only physically, but very importantly, emotionally. Thank you.